Good morning, everyone. I am Esmeralda. Let's begin from the beginning. Okay, are you hearing now? When we think of COVID-19, we often focus on its respiratory impact. But beneath the surface, literally within our bones, another story unfolded. Current evidence and reports indicate the direct relation between COVID-19 and infection and bone health, and thus further research in this field is needed. Today, we're exploring an often overlooked consequence of the pandemic, how it disrupted bone metabolism in Albania. Osteoporosis is a leading bone health disorder in Albania, especially among postmenopausal women and elderly. Studies conducted in the Albanian population in 2015 showed that the prevalence of low bone mineral density in women was 28.4%. Data from Balkan region studies suggest that 15 to 30% of postmenopausal women in the region have osteoporosis, with a similar trend like in Albania in 2022, reporting 33.7% of postmenopausal women. Fragility fractures are a significant burden due to untreated osteoporosis. Hip fractures are among the most common, with a notable increase in incidence among the elderly. For instance, the International Osteoporosis Foundation highlights that fragility fractures represent a significant and growing economic burden worldwide, with annual costs in Europe estimating at 37.5 billion euros and projected to increase by 27% by 2030. The number of osteoporotic fractures is certain to increase in both men and women as a result of the aging population, and 2/3 of all incident fractures occurring among women. On the past 3 decades, advancements in medicines and diagnostic methods have significantly improved the ability to lower the risk of osteoporotic fractures. However, studies in Europe have highlighted considerable variance in how different countries manage the disease. Bone strength is influenced by both quantitative measurement, like bone mineral density, usually evaluated from DEXA, the gold standard for bone mineral density, and qualitative aspects, including bone geometry, microarchitectures, and the composition of its mineral and organic matrix, which are generally not assessed in routine clinical settings. Biochemical markers used to evaluate bone turnover consist of enzymatic and non-enzymatic peptides originating from both cellular and non-cellular components of bone. By identifying trends and gaps in bone turnover markers usage, this study aims to encourage further research and enhance clinical adoption, ultimately contributing to improve bone health management in Albania. Various organizations, including the International Osteoporosis Foundation, recommend that beta-CTX, osteocalcin, and P1NP, particularly for assessing fracture risk and monitoring treatment in clinical practices. Before COVID-19, bone health was the growing focus in preventing medicine. With adequate exposure to sunlight, reasonable activity levels, and dietary balancing, many individuals maintain a healthy bone turnover rate. This equilibrium was critical in preventing conditions in osteoporosis. However, the stability was sudden change and we see the pandemic disrupted nearly every one of these factors. Mostly vitamin D deficiency because of low sun exposure. COVID-19 had several direct and indirect effects on bone metabolism due to the virus itself, the body immune response, producing cytokines, lifestyle changing during the pandemic, and the treatment used for the disease as the steroid therapy. In this study, we analyzed database from private medicine laboratory in Tirana, Albania. The data were collected over a period of time from January 2017 to September 2024. The data were stratified into three district time frames: pre-pandemic, during the pandemic, and post-pandemic. Bone formation markers, we use osteocalcin because the P1NP was not included due to its limited availability in our country. For bone resorption markers, we evaluated beta-CTX in serum. Of course, we analyzed vitamin D because of its use as the regulator of bone metabolism, and the use of it during the COVID pandemic for boosting the immune system. The present analysis examined the trends in bone turnover markers utilization in Albania over different time periods, examining shifts in awareness, diagnostic application, and research focus. The research primarily focused on 3 key biomarkers, as we mentioned above. From the data collected, we noted that the demand for measuring vitamin D levels has increased over the years, as we can see at the graphs, accompanied by growing interest in bone metabolism markers such as osteocalcin. The analysis of test requests from data from 2017 and 2024 reveals a marked increase in the demand for vitamin D testing, significantly outpacing the growth observed for bone turnover markers such as beta cross-labs. Vitamin D tests rose dramatically from 1,198 per patient requested in 2017 to 28,098 in 2024, representing an approximate 23rd-fold increase over the 7 years period. Similar beta cross-labs testing rose from 10 patients in 2017 to 67 patients per year in 2023 and 2024, increasing at 6-fold of beta cross-labs demand, but it still needed still a lot of work. The average age of the study population decreased slightly across the study period. Regarding the average age of participants testing for vitamin D, a gradual decrease was observed during the post-pandemic compared to both the pandemic and the pre-pandemic, as we can see a difference of vitamin D levels from 2017 to 2024. The mean concentration of vitamin D for the total population reached 27 to 27.76 nanogram per milliliter in 2020. Marked rise from 22.3 to 27.76 7.76 nanogram per milliliter, suggesting an effect of the pandemic on vitamin D level. This increase was especially pronounced in the male population. As we can see over there, the difference between female and male. But the mean osteocalcin levels displayed some fluctuations over time. In the pre-pandemic period, the mean concentration was 18.7 nanogram per milliliter in 2017 and 21.48 nanogram per milliliters in 2018. The COVID pandemic period witnessed drop on osteocalcin levels, reaching to 16.32 nanogram per milliliters in 2020 before slightly increased to 17 nanogram per milliliter in 2021. During the post-pandemic, osteocalcin levels showed the recovery with a mean of 18.96 nanogram per milliliter in 2024, returning to the range seen in pandemic period. As shown in the graphic, beta-cross-labs levels mark a marker of bone resorption, displayed a notable trend over the observed period of time. In 2017, beta-cross-labs levels were at the highest, suggesting elevated bone turnover. A gradual decline was observed during the study period at the female population, but a significant increase in male population. There was a significant increase in beta-cross-labs levels, concluding with the COVID-19 pandemic and the post-pandemic period. Stratification of the study population according to vitamin D status revealed significant changes in the prevalence of vitamin D deficiency over time. In the pre-pandemic period, 40.3% of the individuals were classified as vitamin D deficiency. This proportion decreased to about half of the percentage, to 24.6% during the pandemic period, and continued to decline modestly to 27% in the post-pandemic period. Although the number of the individuals testing for vitamin D increased significant, the number of the deficiency individuals decreased markedly, while the percentage of people with toxic level of vitamin D remained really low. Analysis of osteocalcin levels demonstrated a progressive improvement in the proportion of individuals with optimal values over time. Prior to the pandemic, 71.5% of the participants exhibited optimal osteocalcin levels, which increased to 21.1% during the pandemic and further to 22.3% in the post-pandemic period. Conversely, the prevalence of the low levels of osteocalcin declined from 23.1% pre-pandemic to 18.2% during the pandemic and reaching 16% in the post-pandemic period. According to the graphics, the proportion of individuals with elevated beta-cross-lab levels remained low at the pre-pandemic and post-pandemic period. However, during the pandemic, the proportion increased significant to 11.6%, indicating a marked rise in bone resorption activity during this time. Overall, both genders demonstrated improved vitamin D status in the years following the onset of the pandemic, with male participants reaching normal reference levels by 2024 and females approaching sufficiency. Vitamin D levels improved over the study period with a marked rise during the COVID-19 pandemic. Age, the demographic changes also played a role in shaping the trends, with a younger population emerging in the late years. These findings suggest that the pandemic period may have led to increased awareness of supplementation of vitamin D to a better overall vitamin D status, especially in males and younger individuals. Despite the relative increase, the absolute number of tests requested for osteocalcin and beta cross-labs remain significantly low compared to vitamin D. This practice suggests that while there is a growing interest in assessing bone turnover marker, their use is still limited in the clinical file. Potential reasons may include limited clinical familiarity, cost considerations, or uncertainty regarding the clinical use markers in treating patient management outside of specific contexts, such as osteoporosis treatment monitoring, or the the drop in osteocalcin during the pandemic from 21 to 0.48 nanogram per milliliter in 2018 to 16.32 nanogram per milliliter in 2020, followed by a recovery, suggests the potential disruption in bone turnover during the pandemic that normalized in the post-pandemic years. Despite improved vitamin D level, beta cross-labs concentration on indicator of bone resorption showed a significant trend from 2018 to 2024, suggesting increased bone turnover, which may be attributed to post-pandemic lifestyle changes, disruptions in osteoporosis management, and long-term inflammation affected by COVID-19. Meanwhile, osteocalcin bone formation marker declined from 18.78 nanogram per milliliter in 2019 to 16.32 nanogram per milliliter in 2020, and remaining at the borderline levels in 2021, indicating on temporary suppression of bone formation during the pandemic. Although partially recovered, the slower increase compared to vitamin D suggests not recovery in bone formation, while higher vitamin D levels may provide protective benefits. The concurrent increase in bone resorption investigation into skeletal health trends in post-pandemic population. The concurrent rise in bone resorption and the unstable recovery of osteocalcin highlights the need for further investigation for bone health and skeletal risk during post-pandemic. Public awareness and supplementation efforts have successfully improved vitamin D levels. Our data indicates that the bone turnover markers, particularly osteocalcin and beta cross-labs, remain low in the population. This suggests that attention has been primarily focused on vitamin D, while the importance on bone metabolics has been overlooked. In light of these findings, greater emphasis should be placed on the clinical use of bone turnover markers to improve bone health management and prevent long-term skeletal complications in Albanian population. Thank you for your attention.